the incoming president of AIOS, our past chairman scientific committee, past ARC chairperson, and
And he was
Thank you very
among
much.
the best, I think, chairman scientific committee till date, I can say without hesitation. Lot of good people have come, but I think he was among the best.
a very, very humble public prosecutor who has tried, I think, more than 10 times to hang me. All the allegations. So it's always a great learning to hear Dr. Partha's talk, and he'll be speaking on femtosecond laser and managing challenging cases.
Thank you very
Dr.
much,
Partha.
Harshul. Thank you, sir. Sir is always very generous, and I've been learning from sir over the last 25 years. 25 years, Dr. Jagat Ram's session is a no-miss session for me at AIOS. So, and I think that still follows for all of us. So the femtosecond laser, does it hold a promise? Is it a reality? Is it something that we need to have in our armamentarium? And that's something that we need to answer. So I've been asked to talk about in the complicated case scenarios. But even in the uncomplicated case scenarios, there are definite advantages of the femtosecond laser, leaving price as a factor. So, but let us come when we need to actually counsel our patients that you have a difficult cataract scenario, and if you can go ahead with a femtosecond laser, that would give a better option for your cataract. So posterior polar cataract, and this is something that we definitely all the time are aware of. We have our definite amount of advantages, disadvantages, skills. But here, as you can see, that while we are doing the femtosecond cataract, we have decentered, we have taken up the zone, and it is a 800 micron zone in which we have actually done the phacoemulsification or the separation of the cataract. Now, after that, as you can see, that what we need to do is do a very, very gentle rotation, if it can be rotated with not hydrodissection, but hydrodelamination. And in these cases, hydrodelamination, because of the quadrant cut, is quite possible, and it can be done very, very easily. So removal of the cataract is not a difficult aspect. What it gives, what does the femto give an advantage? It gives that cushion of epinucleus which is undeterred. And if that cushion of epinucleus is there, the protection to the posterior capsule is much, much better. And we can remove the cortical matter, place in the lens, and that usually gives a big advantage. The number of PCRs following a cataract, a posterior polar cataract, definitely is less than in the femtosecond laser cataract surgeries as compared to the phacoemulsification. Let's look at the next situation, and this is a very, very hard cataract, as you can see. And does it give definite advantages? Well, the ports can open very well, and making of the ports are not so difficult. And if we have to remove this cataract, you can see that it has the capsular rhexis is floating out. You just have to take it out. But this cataract has to be done, has to be performed with high molecular weight viscoelastic and BSS plus to give a protection to the corneal endothelium as much as possible. Here again, the rotation of the nucleus has to be very, very gentle. Of course, this has been fast forwarded at times so as to give for the time limits. And here we have 6 sextants cut. And what we need to do is all these sextants actually have been severed to 800 to 900 millimeters. So therefore, which leaves only just about 600, 700 of the posterior plate. So therefore, if it can be separated, the separation goes down directly up, leaving only about 500 or 600 microns of the cortical matter as well as the posterior capsule. So you can see that this flower petal opening or the pie opening is very, very swift, and you can do this. And the separation of the nucleus has taken place extremely well, and you can go right down. And of course, phacoemulsification of these fragments have to be done with great care, viscoelastic being supplemented all the time. And if and in such cases, obviously the corneal endothelium is definitely protected. So we go over to the next and the more important part, again, a subluxated cataract with CTR. So you can see that it is a subluxated. There's hardly about 2 millimeters of anterior chamber depth, and the cataract is quite up. So you will see that we have done the nucleus fragmentation. We will do the capsular, we have done the capsular excess also, but we have not done the side ports, because as you can see that the side ports are nearly encroaching when we do it with the side port knives. It is nearly encroaching on the anterior part of the capsule. So we have to be very judicious how we do position it, and once one side port is open, then very gently viscoelastic cover and very, very gentle place hydrodissection has to be done, because you never know which part of the zonule is going to give away. But what is the big problem with the subluxated cataract, and all of us have faced it, is the rhexis. Now here, in this case, the rhexis is very well done, without any trouble, without any trauma, and it has not taken time. So the rhexis and a circular central rhexis in a subluxated cataract which is off-center, even the rhexis can be decentered so as to be positioned well. So removal of the cortical matter and then the rest of the part is not so difficult. At any point of time where the zonules are giving way, it's quite necessary to put in the device, that is the CTR. If once the CTR is placed in, I felt that this was the time that I should place in the CTR, because the shallowing of the anterior chamber, and we wanted to give more support to the zonules as much as possible. Even after separation of the fragments, the CTR can be placed. You just need to identify the capsular rhexis edge, and then it just goes in very well. So with the support of the CTR, the rest of the part is not so difficult. And once we have put in the CTR, of course, the CTR definitely entraps the cortical matter and the cortex. So here again, we all know that how to take off the cortex, and it is a tangential pull of the aspiration that takes off, of the aspiration that takes off the cortex. So the cortex should not be pulled directly to the center. It should be in a torsion, in a circular fashion, and then it swiftly comes out. So with this in mind, and if of course the bag is still unstable, we can put in an AMED segment whenever it is required. And in this particular case, the patient did not require an AMED segment, and as you can see that we are putting in viscoelastic to help stabilize the bag and to have the bag in place. So removal of the cortex, as you can see, is in that same fashion. But if you have done a good hydrodissection, a very gentle one, in such a case, it's not difficult, and the entrapment also is relieved quite well. So with these difficult scenarios, I would really like to say that Femto is definitely a reality, and we are definitely ready for the prime time in Femto. So, but of course, the difficult cases, definite advantages. But if you have access to the femto laser, it also makes your routine cases quite easy. Thank you very much.
Thank you, Dr. Partha, for your very beautiful, showing beautiful videos. And truly, I think in black cataract, such as Dr. Partha showed, femtosecond laser helps in two things. One is very hard cataract. If there is a astigmatism, that at least if it is one diopter or less than one, that can be also dealt. You need not to put toric. So I think these are two things. And very hard cataract, as he showed, you can easily chop then. So I think that was truly beautiful presentation. Any question for Dr. Partha? So with this, I think we come to the end because we started late. we have completed our the small pupil and floppy iris syndrome by Dr. Nipun, and then managing pediatric cataract, managing challenging cases with femtosecond laser assisted phaco surgery, and also phacoemulsification in black and white cataract. I am thankful to Dr. Partha Biswas, Dr. Nipun, Dr. Harshul Talk, and audience, because we started late, and this was the session of Dr. Suresh Pandey, who could not come. So thank you very much, sir.
Thank you, sir. And your presence made it all for us. It was a tutorial class for all of us. This, I think we all agree. Agree or disagree? Agree. Priyam, put up your hands, please. Agree.
I think I always enjoy your this, humbleness, and he is one of the most humble person. If you see his hospitality while he invite, how he take care of the person. He will take care, as parents will take care of the children or senior citizen, like that. Always pleasure. Thank you so much.
Thank you, sir. Thank you.